Everyone, welcome to researchmd.com. My name is Dr. PRAMIL. I'm a program director, physician, internal medicine residency, translational residency program in the United States, associate professor of medicine, two large medical schools. So, we've been doing a series of lectures on the side effects of some of the drugs. Today, we're going to concentrate on anti-obesity drug, Liraglutide. Okay, Liraglutide. First look at it, it's a very good drug to lose weight. And its mechanism of action is a glucagon-like peptide 1. It's a modified version of that. It was initially invented to treat the diabetes. Now they found out it can lose weight. Studies have shown that it can lose up to 4 to 5 kilograms, maybe 10 to 12 pounds by using this drug. Usually dose is like 3 milligrams per daily basis. Now, today's we wanted to know what are the side effects you can expect. Side effects are not very common, but it's good to know because sometimes it can happen. If you don't know, you will not recognize. You end up going to the emergency room or something bad is going to happen. So it's good to know what are the complications, possible complication. It doesn't have to happen all the time, right? But we need to get educated on the side effects. So let's start with the number one question. Can it cause cancer? Yes, studies have shown 3 types of cancer is involved with, okay? One is the medullary thyroid cancer, pancreatic adenocancer, and the breast cancer. Now let's look at the heart. It can cause blocks in the heart, like first degree block, right bundle branch block, left bundle branch block. It's kind of affecting the conduction, electrical conduction in the heart. It can cause your heart rate goes up. Okay. Next thing we're going to look at is the kidney. What happened in the kidney? It can cause kidney failure. The medical terms we use to call this acute interstitial nephritis or tubular necrosis, the damage to the tubules in the kidney. Those are the main things, but it can cause kidney failure. Now, let's look at the CNS. What are the brain effects on this? Number one, we need to know. There are reports it can cause like suicidal tendencies, depression, it can cause dizziness, asthenia. Those are the common CNS complications we have to worry. Now let's look at the abdomen or the belly, like what organs we can have. The main thing, it can cause a lot of gastrointestinal symptoms, which is common with many other drugs. It can cause, you name it, abdominal pain, can cause nausea, vomiting, diarrhea, constipation. Those are the common complaints, like a lot of other drugs have it, right? But let's look at each organ. Let's look at our gallbladder. It can cause inflammation of the gallbladder, okay? It can form stones in the gallbladder, infection in the gallbladder. Those are the 3 things it could happen. Let's look at the pancreas, like what happened to the pancreas. It can cause pancreatitis, that means inflammation of the pancreas, and then it can cause like necrosis, like hemorrhage in that pancreas, like bleeding near the pancreas. That is also very common. Now let's look at our liver. Liver, it affects liver. It can cause like hepatitis, like inflammation of the liver. So it means your liver function test can go up, okay? Now, when we talk about, let's talk about the other system like musculoskeletal. It can cause, muscle breakdown. Your CK level can go up. Okay, and then it can cause, if you look at the endocrinology system, that's also important. Again, this drug can cause hypoglycemia. This drug was kind of made to treat diabetes, okay? And then it can also cause something called amyloidosis. You may not be familiar with that term. What it is, like you can have abnormal protein deposition in many of the major organs. It can affect the heart, usually it can affect the kidney and all that. So that is also concerning. Amyloidosis also